Welcome to SATU Career 2.0 online nursing channel. This is nursing officer exam test series for RRB, MRB, JIPMER, NIMHANS, PGIMS, Orthopedic and BFUHS for core exams. Actually, the exams are getting very near. SATU Career 2.0 nursing channel will give you regularly test series questions to make you prepare and get success in the upcoming exams. So in this video, we are having 50 questions. We will discuss the 50 questions with rational. So please don't skip any questions. Watch the full video to get knowledge about the latest questions and new questions which you can expect in any of the nursing officer exams. Let's see the first question of the day. The heart contracts twice for every heartbeat. One contraction is the atrial contraction, while the other is the ventricle contraction. During ventricle contraction, which two valves of the heart open? Option A, aortic and tricuspid valve. B, pulmonary and aortic valve. Option C, pulmonary and tricuspid valves. Option D, aortic and mitral valves. So simply I am telling the question, during ventricular contraction, which two valves of the heart opens? Guess the right answer. The right answer is option C, pulmonary and aortic valves open during the time of ventricular contractions. Now let's see the question number 2. The healthcare provider is performing an assessment on a patient who is taking propranolol for supraventricular tachycardia. Which assessment finding is an indication the patient is experiencing an adverse effect of this drug? Option A, urinary retention. B, bradycardia. C, paresthesia. D, dry mouth. So what is the adverse effect of the drug propranolol? The right answer, guess. The right answer is option C, bradycardia. The rationale, propranolol is a non-selective beta-adrenergic antagonist. Beta blockade will slow discharge from the SA node and decrease the speed through the AB node. This will slow the heart rate. That is the rationale for this answer. Question number 3. Which of the following is the most appropriate number, range or volume of serum phosphate? Option A, 70 to 100 milligram per deciliter. B, 2.5 to 4.5 milligram per deciliter. Option C, 1.5 to 2.5 milliequivalent per liter. And D, 3.5 to 5 milliequivalent per liter. So the serum phosphate level is normal. Option B, 2.5 to 4.5 milligram per deciliter. So hyperphosphatemia results in muscle and neurological dysfunction. Hyperphosphatemia can display diarrhea and calcification of organs, and soft tissues can show a decreased ability to use iron, calcium, magnesium and zinc. The normal serum phosphate level is 2.5 to 4.5 milligram per deciliter. Now move on to question number 4. Assuming a normal vaccination schedule since birth, which of the following is best indicator at 6 months? Option A, hepatitis B. Option B, measles. Option C, BCG. D, varicella zoster virus. So at 6 months, which vaccine is best indicator in the schedule? The right answer, option A, hepatitis B vaccine is indicated at 6 months for a newborn children. Question number 5. Which of the following principles is affected by a nurse's cultural or ethnic background? Option A, morals, B, veracity, C, code of conduct, D, ethics. Guess the right answer. The right answer is moral values are affected by a nurse's cultural or ethnic background. Question number 6. What is the final step in the ethical decision making process? Option A. Make changes based on an evaluation of the original plan. Option B. Carry out the decision. C. Consult an ethics expert or committee. Option D. Identify the issue. So, which is the final step in ethical decision making process? The right answer here, make changes based on an evaluation of the original plan. So, an ethical decision making process have several steps. First step, identifying the problem. Second step, researching the issue. Third step, determining who will take final decision. The next step is evaluating the ethical issues, and next step, looking for alternative. Final step is modifying it based on evaluation of the proposal. So the right answer is option A here. Question number 7. All of the following are one of the 5 rights of delegation except the. So here the 5 rights of delegation are given. Which one is not included in that? Option A, right department, B, right communication, C, right person, D, right circumstances, E, right supervision, F, right task. The rights of delegation which is not coming under the 5 is option A, right department. The rights of delegation includes right task, right circumstances, right person, right communication, right supervisor, and evaluation. Question number 8. Which of the following process will assist patient in obtaining necessary information or therapies for optimal outcome? Option A, multidisciplinary care, B, managed care, C, health care, D, case management. So which of the following process of a patient will get necessary treatment therapies for optimal outcome? The right answer, option D, case management. Case management is the process of assisting patient in obtaining necessary treatments for optimal outcome. Case management is a very individualized process and is specially tailored towards the needs of an individual patient. So the right answer is option D, case management. Question number 9. A nurse is planning to reinforce instructions regarding nutrition to a Muslim patient. The nurse should be aware that certain foods are prohibited by this religion. Identify the food which is prohibited in Muslim patient. Option A, meat, B, pork, C, beef and veal, D, spicy foods. We all know very well the right answer is option B. Pork is prohibited for eating in a Muslim peoples. Question number 10. A nurse is planning assignments for the upcoming shift. Which of the following would be the most appropriate assignment for the nursing assistant? Option A, perform a bed bath on a diabetic patient who is bedridden. Option B, obtain the vital signs of all patients on the floor and record the results in a medical chart. C. Accompany an Alzheimer patient to the bathroom. Option D. Provide feeding assistance to a client who experienced a stroke 3 days ago. So, which is the best nursing intervention a nurse must carry after getting the handover from a previous shift nurse? So, the immediate action the nurse should give for the patient who is in bedridden and who needs bed bath. That is the priority nursing action to be done by a nurse assistant. Question number 10. A nurse is received orders to administer a RHO-GAM injection intramuscular to a postpartum patient. Which situation is not a contraindication for administration of this injection? Which situation is not a contraindication for administration of this injection? Option A, administration of the injection within 72 hours after delivery. Option B, administration to a patient with an elevated temperature. Option C, administration to an RH positive female patient. Option D, administration to a patient who has a history of systemic allergic reaction to preparation containing human immunoglobulin. So, for which patient we will administer RHO gamma injection intramuscularly? The right answer is option A. It should be administered for after delivery within 72 hours in a RH negative female patient. Question number 11. Nandini is obtaining the vital signs of a toddler who is in the pediatrician office for his 18-month checkup and scheduled immunization. Which set of vital signs would need to be brought to the attention of the pediatrician? Option A, temperature 98.6. Option A includes temperature 98.6 Fahrenheit, respiration 32, and blood pressure 122. Sorry, this one the um, heartbeat 122 breaths per minute, and blood pressure 90 by 58 millimeter of mercury. Option B, temperature 99.6, respiration 30, pulse 102, and this one blood pressure 82 by 54, temperature 97.6. Option C, respiration 20, pulse 82, blood pressure 84 by 54. Option D, temperature 97.6, respiration 22, pulse 100, and blood pressure 86.56. So in toddler, which set of vital signs would need to be brought to the attention of the pediatrician? The right answer is option B is completely abnormal. The temperature is high and respiration also very high. Pulse rate is having tachycardia and the blood pressure is very low, 82 by 54. Comparing to all, here the blood pressure is very low. So this has to be immediately reported to the pediatrician. Question number 11. A client comes to the doctor's office with first degree sprained ankle. Which of the following treatment does the nurse anticipate? So in sprained ankle, the treatment anticipated by the nurse. Option A, cast, B, splint, C, rise therapy. Rise, R stands for rest, I stands for ice, C, compression, E, elevation, D, surgical repair. So in in case of sprained ankle, the nurse anticipate for rise therapy. Rise therapy is the best treatment expected to give for client having sprained ankle. Question number 12. A client is receiving digoxin, exhibits tachycardia and complaints of headache and fatigue. and nausea, diarrhea, and halovision. Which of the following is probably the cause? Option A, too low dosage. B, allergic response to digoxin. C, digoxin toxicity. D, disorders unrelated to digoxin. So, which is the very important cause for these symptoms? The right answer, as you guess, the right answer is digoxin toxicity. Digoxin toxicity, while digoxin is used to slow the heart rate, digoxin toxicity may result in either tachycardia or bradycardia as well as almost any type of dysarrhythmias can occur along with this. Question number 13. When taking an adult's client pressure, the lower border of the cup should be how far above the antecubital crease? Option A 1 centimeter, B 5 centimeter, C 2.5 centimeter, D 7.5 centimeter. The right answer, option C 2.5 centimeter. The blood pressure cup should be just above 2.5 centimeter above antecubital fossa when you take blood pressure in a client, adult client. Question number 14. Which of the following should never be delegated to unlicensed assistive personnel? Mostly this is happening in government hospitals. Some of the books are delegated to unlicensed assistive persons. Which one should not be delegated? Option A, bathing the patient. B, monitoring and controlling breath therapy. Option C, ambulating the patient. D, monitoring the urine output. Yes, the right answer. The right answer is option B, monitoring and controlling blood therapy should not be given to any unlicensed assistive personnel or untrained professional, untrained personnel. It should be done only by nursing professionals. Question number 15. Which of the following is the most effective scale for assessing pain in a 6-year-old child? Option A, Wong-Baker Faces Pain Scale. B, 0 to 10 Numeric Pain Intensity Scale. C, Pain Add Scale. D, Cry Scale. So, in a child, 6-year-old child, which pain scale is most effective to assess the intensity of pain? The right answer is option A, Wong-Baker Faces Pain Scale is a very effective scale in assessing pain intensity in a 6-year-old child. Move on to next question. Which of the following are the examples of autoimmune disorders? Select all that apply. Option A, Guillain-Barré syndrome. B, diabetes mellitus type 1. C, rheumatoid arthritis. D, Hashimoto-thyroiditis. C, osteoarthritis. So, which of the following are the autoimmune disorder? Here, there are many answers for this single question. So, right answer is option A, Guillain-Barré syndrome. B, diabetes mellitus type 1. C, rheumatoid arthritis. D, Hashimoto's thyroiditis. These all four are autoimmune disorder examples. Question number 17. The short containers in the client's hospital room contain the following symbol. What does the symbol signify? Option A, poison. B, danger. C, biohazard. D, short. So this symbol indicates biohazard waste. Question number 18. Following the death of a client, the nurse anticipates the rigor mortis will begin in what period of time? Option A, 4 to 6 hours. B, 2 to 4 hours. C, 1 to 2 hours. D, 30 to 60 minutes. Rigor mortis is anticipated to occur in 2 to 4 hours. Following the death of a client, rigor mortis usually begins within 2 to 4 hours because adenosine triphosphate, which is necessary to relax muscles, is no longer synthesized. So muscles contract So this is the right answer, 2 to 4 hours. Question number 19. Which of the following is an indication of primary graft dysfunction in a lung transplant recipient? Option A, frequent oxygen desaturation, B, chest pressure, C, fever, D, cough. So in a primary graft dysfunction, particularly in a lung transplant claim, which is the indication? The right answer, option A, frequent oxygen desaturation. Primary graft dysfunction is also called as reperfusion injury, is a major cause of illness and death in lung recipients with symptoms and treatment similar to acute respiratory distress syndrome. So option A is right. Question number 20. The client is wheeled into the delivery room and is ready for childbirth. While crowning occurs, the nurses applies gentle pressure over the perineum and fetal head. The maneuver performed is called option A, Brandt-Andrew maneuver, option B, Mack-Roberts maneuver, C, Skulls maneuver, D, Ritogen's maneuver. So when the nurse applies gentle pressure over the perineum and fetal head, the maneuver is known as option B, Ritogen's maneuver. Let's see the explanation for other maneuvers. The Brandt-Andrew maneuver is the proper extraction of the umbilical cord and placenta. Mack-Roberts maneuver is performed in case of shoulder dystocia during childbirth. Skulls maneuver is used to describe placenta delivery. The Ridge-Jones maneuver is performed by applying pressure over the perineum and counter pressure on the fetal head. The Ridge-Jones maneuver controls the exit of the fetal head and prevents severe damage to maternal tissue. So option D is right. So now we have seen 20 questions. The remaining 30 questions you will see in the next video. Please click the next video and you can watch it.